Well, I'm going to be very serious today, not my usual humorous. I want to thank, first of all, Alan for inviting me to speak, but most of all, thank Alan for his commitment to this program. And as Mark said, my experience at the foundation is it's very seldom you find somebody who has the vision, who then can implement that vision and manage that vision. A lot of times we have to replace the person who had the vision with the next leader. It's a different set of leadership skills, and Alan has them all. So, unlike my political science, I am going to go along with Ed Tufte and not use PowerPoint, and I'm also going to not do any numbers today, which is the kind of political science I did at one point in my life. I want to talk very personally about this program and about the program, what it meant for me. And I want to talk in two categories. One is the friends I've made here, and the second is the things we've accomplished here. If I mention all the friends I've made here, you would get hungry around midnight. But I do want to mention one person, and that's the person that Mark mentioned, and that's Rashi Fine. I didn't know Rashi before this program. I went back and looked. I bought his book on medical care and medical costs in 1986. I wrote on the back of the book cover when I bought it. I put 1986 there. Rashi's life is fundamentally the history of the Medicare program from idea to administration. And he wrote about that. He wrote a chapter in Medicare and Medicaid at 50 on that. His life was a partial history of the efforts of America to expand health insurance coverage. And as you all know, he had academic appointments at UNC and Harvard Medical School. Now, I want to spend one moment on something that only, I think, Alan knows about Rashi. As from 1973 to 1976, Rashi was involved in an RWJF grant. It was a grant to give doctoral and postdoctoral fellowships in health for economists at Harvard. At the end of that program, 3 years, three-year grant, at the end of that grant, Harvard returned much of the money because young economists were hesitant to study health. Now, looking back from the perspective of today, we can say it was very successful. There was a young medical student, Steve Schroeder, who was at Harvard at the same time, who was influenced by this program, influenced, as Alan said, when he became president of the foundation, to develop a program for economists. And Jim Rohn, I'm glad you were nodding yes to Alan, because that was a change in this program that Alan just talked about, of bringing in political science and sociology with the economists and making it interdisciplinary. That Harvard 3-year grant also produced some of the most successful health economists of my generation. Hal Luft, who many of you have worked with, Paul Ginsberg, who I worked for, Will White at Cornell, and David Saltkever at Johns Hopkins. Very successful now. At the time, people thought it was an unsuccessful grant. So I always looked forward to Rashi sharing his wisdom in his talks at the beginning of this annual meeting. And frankly, it's impossible for me, maybe possible for others, but it's impossible for me to describe the richness of the wisdom without a complete retelling of his stories. For those of you who weren't here, You can read Rashi's book, Learning Lessons. Actually, for those of you who were here, you should probably reread Rashi's book, Learning Lessons. These were all derived from the talks here. Rashi shared his wisdom about the need for interdisciplinary approaches to health, about the importance of words in policymaking, and about a just society. I count him as a friend. He was a friend of this program, and there are many other friends in this room and other places that I made in this program. So let me talk about the second thing I want to talk about, the changes we've made. Jim Rohn on Wednesday night hinted at what political science was when he came through. Jim is a baby boomer, early baby boomer, right? I'm in the previous generation. I don't know what demographers call my generation. What's the generation before the baby boom? I mean, I sort of think of it as the troops came home. Well, it's the children of the greatest generation. It's the children of the greatest generation, and there were boomlets, there were actually baby boomlets when troops came home from World War II. So I'm a little ahead of Jim in terms of my experience, or a little behind Jim in terms of my experience. But I want to use my experience as a contrast model, as a non-quantitative way of thinking about what this program has done. And the political science I experienced was quite different from the political science you experience, and especially those of you of the later cohorts. Policy was generally not thought to be part of political science discipline. There was one subfield in political science that had a strong policy component, and that was international relations. I'm hesitant to call international relations a science. It was largely a combination of strategic thinking and a dose of ideology. Think of Henry Kissinger. But nevertheless, the discipline accepted this policy approach as part of the discipline. So when I got my degree in the mid-1970s and was a young assistant professor in the 1980s, I felt there were no mentors for me, no role models for how one did the kind of political science I wanted to do, where one published the research, what one talked, how one got tenure, and how one got promoted. Of course, there were two notable exceptions to what I've just said. One was Ted Marmer, and Ted had written his book on Medicare, which really fit into the congressional literature in political science. Jim Rohn was very fortunate, as were a number of other people very fortunate, to have Ted as a mentor and as friend. Ted wasn't in my network, and kind of political science I did didn't quite fit the kind of political science he did. He wasn't even in my network of networks. So a second exception was the Journal of Health, Politics, Policy, and Law. In 1976, Ralph Straits of NYU became the first editor of J-HIPL. Straits was a political scientist who had spent most of his career researching local and state government, constitutional structures, proportional representation, the progressive movement, old-fashioned reformist state and local government political scientist. In the 1960s, Ralph Straits had a grant from NIMH to train political scientists in mental health issues. Who would have thunk? Why? Ralph was really a missed opportunity for me. Much later in the 1990s, I discovered that Ralph Straits and I had the same PhD advisor 25 years apart. The world would have been a lot better if I would have networked with him. So, no mentors, no role models. What did it mean? Well, it meant you're on your own, bleep. At Williams College, I had a 3/5 appointment in political science and 2/5 appointment in political economy, which was their public policy program, undergraduate public policy program, which was supported by a Sloan Foundation grant at the time. And I decided that my approach really to getting tenure in publishing and research was to have two tracks. I would have one in more traditional political science, although some might argue I was never in traditional political science, and one in health policy. At one point, an untenured economist, Mort Shapiro, who's now the president of Northwestern University, and several other untenured economists at Williams, and I had a $500,000 grant for policy analysis for the Healthcare Finance Administration, which is the forerunner of CMS. I suspect it was probably one of the largest pieces of research funding in the history of the college. It didn't count in my tenure decision. Actually, it was probably a very strong negative in my tenure decision, even though I had this 2/5 appointment in a policy program. So let me fast forward a little and fill in a little gap. Like you, I received a lot of help. I received a lot of help in health from an RWJF fellowship, from an NSF award in evaluation research, which was working with Peter Rossi, sociologist, who was at UMass at the time. And I had a number of great health mentors over the years. What I never got was the connection between political science and my health work. I didn't have the connection that you have. Fast forward my life, I was working for MedPAC, and I decided that it was time to leave MedPAC. I took a position at RWJF. What a thrill it was when Alan Cohen invited me to the scholar selection meeting in December 1997. This was before I actually had started working at the foundation, a month before I had started working at the foundation. Finally, I felt I had political science redemption after years in purgatorio. So what did I get from this program? Why was it important to me? Well, I got a hat. Actually, I got a whole collection of hats. I didn't have room in my suitcase to bring them all. But I've gotten so much more. I've participated in an effort, as Jim Marone noted on a Wednesday night, an effort to fundamentally change the disciplines. We've legitimized the study of health and health policy in 3 disciplines. We've promoted cross-disciplinary studies of health issues. You've received significant grants. You've conducted consequential research, highly cited research, and many of you have received old-fashioned media coverage as well as plenty of coverage in social media. What a different world it is than the world I experienced or those young economists experienced in the grant at Harvard in 1973 to 76. We have created a new generation of thinkers, and I want to conclude by saying I treasure the friends I've met here, that I've made here. I treasure the changes we've made here, and I treasure the impact we've had. Thank you.